Welcome to the Business Performance Podcast, where we feature expert thought leaders and cover their best strategies, stories, and advice that you can use to successfully mature your own business performance. Now, here is your host, business coach Henry Schneider. Hello, everyone. This is Henry Schneider with the Business Performance Podcast. And today I'm talking with Colin Mulholland, who's the Organizational Change Management Enterprise Practice Leader at Change Healthcare. So, Colin, welcome to the podcast.
Hey, Henry, thanks for having me.
Okay, so to put things into context for our viewers and listeners, would you please briefly describe Change Healthcare, the company itself, the types of customers you service, and the products and services that you provide?
Yeah, absolutely. Henry, just thanks for the opportunity to have this dialogue. I know we've connected a couple times, and it's always fun to continue the conversation. So thanks for creating the space in this community. So I've been at Change Healthcare since October of 2018. We have recently gone public. So in June of this year, we submitted IPO. We are a healthcare technology company. We have about 14,000 employees, and I think our niche in the market is that we process $1 trillion of medical claims transactions annually. We sit in the epicenter of healthcare. So we sit between payers, which are insurance companies, providers, healthcare networks, and consumers. And we have a vision for inspiring a better healthcare system. And we believe that's going to be done through the data and embedding technology to make healthcare more open, transparency, as well as making the consumer experience what folks have come to expect from other industries and make it look like that in healthcare.
Okay, so what is your definition of quality in terms of Change Healthcare? What does it mean to you, and what does it mean to Change Healthcare?
Yeah, one of our leaders, Gautam Shaw in San Francisco, says frequently, "We are them." So it's not uncommon for us to think of ourselves as the patient in the healthcare system. We understand the complexities. We understand that this system has significant spaces for improvement. And I believe that it's our willingness to commit to quality that's important on the transformation journey with payers, providers, and consumers.
Okay. So what is I mean, quality is a broad term. So what do you how would you define it for your space?
Yeah. I think quality is it's a experience. So it's an experience that's seamless and able to be navigated. So it's no longer that healthcare patients or healthcare consumers or healthcare providers are able to get away with things that seem ambiguous, things that don't seem clear. So I think when we consider quality, or my perspective of how we consider quality as an organization is starting to consider transparency. So platforms and capabilities that offer the patient or the provider more visibility into the process. I think that is one of our focal points. But then it's also kind of integrating the system because we sit between patient, provider, and consumer. We have the opportunity to bring partnerships in the healthcare ecosystem and also outside to just enhance the overall quality. So I'm not sure if I dodged the question around quality, but I do believe that the vision is to make the experience both within the healthcare ecosystem raising the bar on what quality is, regardless of what your definition is, whether you're a consumer like you and I, or a provider or a payer.
Okay, so when you look at the patient, provider, and consumer, what are some of the biggest misconceptions out there with respect to quality or performance?
Yeah, so I think one of the misperceptions is that the data is able to be connected. So healthcare, for various reasons, and some of them make sense, seems to be uh, data filled, right? There's a lot of information that we give to both our insurance provider as well as our hospital system. But I think there's a misperception of how convoluted maybe some of those data streams and those data lakes are, and that healthcare has maybe been underinvested in terms of innovation on the technology side. So I think we can experience that at an individual level. Like, we're still completing paper forms that basically all say the same thing.
Yeah.
And there's this opportunity to interconnect it, but it involves making that data a little bit more clean because it wasn't leveraged in a way that it will be in the future.
Okay. All right. So right now, what is the number one biggest challenge that Change Healthcare is facing with terms of performance?
Yeah, so I'll speak to the work that I touch most frequently, and it's this space that is complex. There's not necessarily a destination that we can work harder or more efficient to get to, but directionally we can agree that there's a place that the healthcare system needs to go. And I believe it's navigating those uncertainties and those complexities with a level of confidence, knowing that directionally we need to go in this direction. So as you start to consider performance, it's not as specific or it's not as exact, and it's there's the phrase "be comfortable being uncomfortable," but I think it's more than that. It's how do we start to embed more feedback loops with our customers, with our employees, to ensure that we stay going in the right direction.
Okay. All right. So what are some of the common fears that the employees face with those types of challenges?
Yeah, there's there's a good amount of them, right? So we merged two companies together a little over 2 years ago, and there's a reason these two companies existed in the past, right? And now that we're a new company, we have market share. Like, our clearinghouse processes $1 trillion of medical claims transactions. Like, we have significant market saturation. And we also know that the way that we're doing business today, or the way that we've won business in the past, is different from what our customers and what the consumers are looking for in the future. So I think any leader, regardless of industry, but it also holds true in our organization, is how do you deliver on results today operationally while preparing for the future, while setting the direction of where we need to head. So we need to deliver today, but we also need to be sure that we're directionally headed into where our customers and consumers are expecting us to be.
So what do you do on from a practical standpoint to get people past the fears?
I think you acknowledge them. I think fear is a very human quality. And I think there's some context shaping as well, right? It's very rare that you hear an athlete talk about being fearful or scared, but you can hear them talk about excitement.
Mhm.
And ultimately, from a psychological standpoint, it's an anxiousness. It is the fight or flight response that our individual minds can't quite comprehend, whether or not our ego is in jeopardy or we are in a life or death situation. So I think it requires a certain level of openness that this feels uncomfortable, and that's okay. And as trust builds, as relationships build, both internally and externally, I believe the anxiousness about the uncertainty becomes a little bit easier to bear when you lock in together, both with your employees, with your teams, as well as with your customers, because no one knows the answer, right? No one knows the destination. We just know we need to head directionally in that direction.
Okay, so would you be able to share a story with our viewers of how you helped somebody overcome these obstacles and succeed? I guess since you've started at Change Healthcare.
Yeah, sure. So I think I don't have a specific like personal example, but at a large scale, there's a practice called a lean coffee. And we leverage a tool, we're starting to experiment with it, called a lean coffee table. So one of our groups is undergoing a significant reskilling. And as opposed to coming to that meeting and talking with these 50 leaders and saying, this is what it's going to look like, these are the exact right answers to do, and this is the script, we invited those 40 or 50 leaders to share with us, what is it that you're concerned about? What is it that you need clarity on in order to lead your team well? What gaps or historical things have taken place that we need to have a conversation around? And I don't really believe in or subscribe to best practices. Like best practice means like it works every time. But situationally, we need to have an understanding as to what tends to work in our environment, what tends to not work in the environment, as well as competing priorities. So I don't know if there's rubber stamp, like Colin helped me accomplish my fear, but I believe there is definitely a space and a place to open the conversation, to invite people, leaders too, to share, man, I'm not as confident as I think I should be leading through this time of uncertainty, and here's why. What are your thoughts?
Yeah. So I just want to touch on what you said about best practices. I mean, that's a term that's thrown about quite a bit. Some people are very restrictive about it. From my perspective, it's what works best for you. You know, is it working for you? Is this something now we can distill and bottle and make work for somebody else? That's an internal best practice. It doesn't have to be something to do it this way every single time. But how does it enable you to do your job and get your job done with the least amount of effort?
Yeah, I've got a friend in Toronto who Jason Little, and he leads a lean change management practice. He's the founder, and he says use what works and forget everything else.
Yeah.
And it's this willingness to experiment with what might work and be okay if it doesn't, but always being curious about what might work in our environment and never getting too complacent that the best practice of yesterday will solve for tomorrow's challenges.
Well, then, yeah, you also get faced with that paradigm. If it ain't broke, don't fix it.
I believe that's something that organizations that experience success, right? I had a basketball coach say that the most difficult teams that he ever coached were his smartest ones because they were used to being right.
Yeah.
So how do you ensure that there's a spirit or a culture of learning or a culture of innovation so that people are always challenging what is possible, not allowing for the status quo to overwhelm the environment?
Yeah, I mean, that's the whole thing. People get stuck in their way of doing things. And when you got a young population, it's easier to influence them or brand new people in the organization. But if you got a group of people that have been there 10, 15 years or more, they are cast in concrete, and moving that needle is going to be very difficult.
Some of them are, right? I think that's true to a degree, right? I think there are folks that have experienced new ways of thinking and that are open to it regardless of age. And maybe it's a part of their upbringing. Maybe it's a part of their career journey. But I that change will be constant in the future, and our willingness to ask, is this still the best method and why, and challenge what is currently in place, and think together to co-create what could be possible, whether it's bringing in different disciplines together that didn't used to be, like removing arbitrary boxes and narratives that we've created in our head to allow for the best ideas to take hold.
Yeah. Yeah. So that's, now you're kind of getting into your humanizing of work. So can you explain that a little bit? Why that excites you?
Yeah. Yeah. I love it, Henry. I believe that all of our workplaces are full of human beings. And regardless of where we're going with advances in technology, which we've already experienced, right? When you think about how easy it is for us to communicate via video, that didn't exist the way that it does today.
Right.
The way that we're able to assess products or determine whether or not certain products would be best fit for us. Like there's a term called the social media megaphone, right? Internal and external. And I believe that we should ride that wave and be willing for that to further humanize and create spaces and places for people to connect in a human way, and not a check the box way, not a this is my theory and framework and we have to do it this way. I believe that the only way that things have changed across centuries is through humans engaging with each other to share knowledge across other people. It used to be survival, and now it's a way that globally we're doing much better than we used to.
Yeah. Well, it's the human interaction and the relationships. That's what's really important. And technology just either gets in the way or enhances it, but it's still the human interaction. Because if you didn't have the human interaction, there'd be nothing going on, right?
That's it. Yeah.
Okay. Go ahead.
Yeah. I just share there, like, we are innately relational.
Mm-hmm.
Like Steve Jobs tells a story about even though he was parted from his mom early at birth, he was forever grateful for what she did, because without her, there wasn't a him, right? And it's this concept that when we step back and assess groups of people or systems of people, there is much more that is the same than that is different about us. And I think we should rally behind that a lot, as opposed to allowing some bias or way that you view the world to get in the way of what could be possible if we were able to create those bridges.
Okay. All right. So, Colin, you've had a very interesting career, from teaching in the inner city schools of Atlanta to now being a change management enterprise leader. So, what was the defining moment over your career that led you to where you are today?
Yeah. So 2011, I am a part of an organization called Teach for America. I am in DeKalb County in Atlanta. I was teaching sixth grade earth science. I probably hadn't seen earth science since high school of my schooling. And I was teaching students from 40 different countries that spoke 51 different languages. One of the most diverse groups of people in the entire world. And what I learned very quickly in those days in the classroom, I spent 3 years there, but I learned it really quick, was that the only way for knowledge to be transferred is if first folks believe that you trust them. So there was a level of empathy that needed to take place, not for circumstances, but for an understanding that I see the world, because of my upbringing, different from theirs, and neither is right or wrong. But it was this curiosity to learn alongside my sixth grade students that was just invigorating. And it also showed me that although we grew up in different zip codes, the talent isn't dictated by where someone grew up. So this belief in other human beings being able to solve problems and work together to accomplish great things, that is human. And we get in the way of that a lot with our systems and our policies that we put in place. And I think that's where, not where it started, but it's where it validated this humanizing work, was in Atlanta in a sixth grade classroom for 3 years.
Okay, very good. So, what is another question, kind of building on that, is over your life? Could you share an experience you had early on that still influences how you approach business today?
Yeah, so when we kind of talked about this, it was a different story, but I think about my grandfather, Joe Mulholland, and he lived in New York where I was born. I spent 2 months there, and he's since passed away. But my pop grew up with polio, and he lived from age 4 to early 70s with a big metal brace. But he never allowed for someone else to label him as anything except for someone who was passionate, someone who loved people, and someone who was willing to fight for what he believed in. So he was a social worker, and he was a parole officer, and he fought for African American women, adult women education in the 70s. No one was fighting for that. Not people that looked like my granddad. And I loved that story and that narrative. And I've kind of taken it to heart, that we shouldn't let other people dictate what we might be possible of achieving. And as long as we are deeply embedded into what we believe to be right, we should find other folks around the world that are willing to fight those fights and create those bridges and I think impact the world, right? I don't think there's limitations. When folks used to say we could change the world, folks used to kind of be like, oh, he's just young. But with technology and the globalization of where we are right now, I think thinking about anything less than that doesn't excite me.
Okay, very good. That's wonderful. So thinking about success now, and Colin Mulholland, what does success look like for you?
Yeah. So success looks like this. Success, I believe my life mission, right? So bigger than my workplace, is collaborating with others to lead people-driven change that creates an impact larger than self. And what that looks like for me is sharing what I've learned, sharing what motivates me, but also learning from folks that have seen a different career path or different work, with the sole intent of bringing purpose and happiness and value to all of the places we interact. And it's bigger than me, but it's sharing that knowledge in a way that's so open that others are able to take it wherever they go and to embed it. There's a storyline there that Melinda Gates talks about, and she was just leaving Microsoft. She talks about this on her Netflix special. She was leaving Microsoft and she wanted to go into the foundation work. And she was meeting with a former president, and she said, hey, we've got these dollars, we've got these really passionate people, and we're going to go into sub-Saharan Africa, and we're going to disrupt change. And the president, I can't recall which one, it was here in Atlanta, offered the advice, and he said, Melinda, I don't doubt that you will be able to be successful. you're smart, you're well-funded, and you're passionate, and you've got a heart for people. But I wholeheartedly encourage you to consider what that group of people deems to be important. So don't go push your initiatives and your agenda on other people, but ask what their initiative and their agenda is, and maybe give up a part of yours to ensure that it is embedded into what they do, what they believe, and that it leaves a legacy beyond you just being there, right? It's that, how can this be sustained with what they believe to be important? And I find that really compelling. I think there needs to be a little humility and definitely empathy. But I think it's when those bridges are able to be crossed, it's exciting to what's possible.
Yeah, that's a very good point. And I think that's one of the reasons why Americans get a bad rep, because we go overseas to try to impose our systems on somebody else that's not what they want. So.
Yeah. I was having a conversation yesterday morning, a coffee meeting with a few leaders in the customer experience and change space here in Atlanta. And the conversation started similar to this one, and then it evolved to where we are right now.
Yeah.
When we start thinking about how could we leverage these practices of rallying people together to achieve a common vision with shared goals and a consistent, relentless, and persistent focus on the execution, what world problems could we solve? Because when we start thinking about empathy interviewing with folks that are going to be impacted by the change, and then we co-create it with those that are impacted, and then we iterate that approach over time, there might not be a destination that is unsolvable if we're able to say that we don't have all the answers, but we're willing to get to the right directional space together.
Yeah, and that's kind of like a lean approach to it as well. You try it, you keep rechecking, form a hypothesis, check it, works. No, but keep the end goal in mind and just keep working towards that.
Yeah, I think it's sometimes in life, and I'm starting to appreciate it much more, that you look back and you're like, wow, how would the scientific method that I was teaching in inner city Atlanta apply to the work that I'm doing at one of the largest healthcare technology companies? And it's exactly that. It's this whole idea that we should create hypothesis. We should go amongst the people to understand more deeply what it is that needs to be tested. We should experiment, and then we should iterate around whether or not we have a conclusion or not. Yeah. And that feedback loop should never cease. And I think it's exciting to me that those practices are very, they're tested, right? Mm-hmm. That approach to solving problems has been how people have solved world problems.
Right.
So if we can get our ego out of the way of being right, and we can start to actually listen to people, employees and customers, to get the best directional sense.
Yeah. There's a reason why the scientific method has lasted for millennia. You're being objective. You're trying to, focus in on the facts and making adjustments and testing and refining, as opposed to just going with gut feel.
Yeah, I don't know how scientific it is, but something that I've heard and I can definitely relate to is that at a very human level, people want two things. People don't want to feel like they belong, and people want to feel like they're valued. Mm-hmm. And if we can get to that space together, it doesn't matter what project we're working on or what solution we're going after. It's that trust and willingness for the best answer to come forth that is a competitive advantage for those companies that are able to get there. It's a cultural competitive advantage that is starting to prove itself in the stock market.
Yeah.
It's,
Okay. So kind of shifting a little bit, but in the same vein, when you are talking with people now, even with the coffee chat you had yesterday, what are some of the words of wisdom that you use to get your point across?
yeah, I don't know if that's the objective, to get the point across, but I think to stimulate the conversation, which is probably the intent, right? To stimulate the dialogue, I start with co-creation. And it's this idea that people don't reject plans they help create. So if we're able to involve those that are impacted by the change on the beginning, not when we tell them this is going to change and we do carrots and sticks to maybe motivate people, but we involve them early on. So people don't reject plans they help create. I love that phraseology there. And then another phrase that I tend to bring about, like in conversations with executives or with teams, is take care of yourself. So embedding mindfulness in a lot of my engagements. I've practiced mindfulness for about the last 2 years. It's just starting to make sense for me since I committed to it this year. But it's this whole idea, if we're able to take a deep breath and be present in the moment and see it as that, we are removing ourselves from the emotional creatures that we are. So the ego gets out of the way and we're actually able to hear with the intent of understanding as opposed to with the intent of responding. So I think take care of yourself. Change is really difficult. Large systemic change is even more challenging. So take care of yourself if you're hopeful to lead others. And then the last one is enjoy the journey. So if we don't look at this as like a destination, like the project charter is going to last for 18 months and then we're going to get there, because that's likely not the case. With the amount of complexity and uncertainty that exists in the world, but definitely in our work environments, we shouldn't be so certain that we know the answer and it's going to be solved and we're going to land at a destination. So enjoy the journey of that experimentation. Enjoy the journey of getting feedback and getting better together. So that third one that I'd say is enjoy the journey and treat it as such.
Okay. Wonderful. Okay, Colin, we're rapidly running out of time here. We could keep going on and on and on. So, how can people contact you to get more information about you specifically and Change Healthcare?
Yeah, I appreciate that, Henry. LinkedIn. LinkedIn is a place that I seek to build community. In 2020, I will be sharing a little bit more about my experiences because I've gained so much value from folks like yourselves in these communities that you've stood up, that have been stood up. And I just believe it to be win-win. So I'd say find me on LinkedIn. I'd love to chat. I'd love to learn about what problems you're trying to solve for. And then if there's a place for us to align or think through something, I'd be happy to do that too.
Okay, wonderful. So, Colin, you're a great storyteller. I really enjoy your whole focus in on change management and humanizing the workforce and getting people to participate and co-create. That's just wonderful approach to the world and relationships. So thank you so
Awesome.
much for
Yeah,
your time today.
absolutely. Henry, I enjoyed it. Thanks for making this space. Thanks for having this place for us to connect and really enjoyed it. Thank you.
Thank you so much for tuning into this episode of the Business Performance Podcast with your business coach, Henry Schneider.